Well, good evening. My name is Susan Butler, and I'm glad to welcome you here to the July meeting of the League of Women Voters. Our topic tonight is health care, and we have speakers of Jim Abeler, who has served as a state representative since 1999 and recently was elected in a special election to the state Senate. And then we have Carolyn Laine, who is here from Columbia Heights. She was initially a state representative and was elected in 2006. So they both have served our state for quite some time, and they have some expertise on the subject of health care. Jim is going to talk, I think, somewhat about what happened this year in health care with the legislature. And Carolyn is going to address a little bit of the work that she has done with John Marty in the area of kind of a vision for what healthcare can be. So thank you very much for coming, and we'll turn it over to our speakers. We will have questions, so I have a few already. So thank you.
Well, super. Thanks for having both of us. And, you know, in contrast to the work of the Minnesota legislature, and especially the federal legislature, we are going to solve it tonight in a bipartisan fashion. We're going to leave out of here agreed with a plan that's going to work, and, well, at least we're going to have a good discussion. And I want to thank the League. I've enjoyed these various forums you've had over my 2 centuries of service, somebody pointed out. And your openness to ideas and debate and fair discussion. And so the whole healthcare thing, I have a career in healthcare as well. I've been a chiropractor for 38 years, which doesn't seem possible. And so I've been a part of the system and maybe on the edge of the system a bit, but you know, we're proud of America's healthcare system, but I should just say sometimes wrongfully so. We spend the most to have some of the most mediocre outcomes there are, and so the golden good old days weren't bad. At least it was more affordable. But some people were left out, and it did really matter if you had a good job or not, and if you were in hard times, sometimes it was a challenge to get the care you might need. And over the years, especially, there was a group of people, and in particular some single adults over 50, who had a hard time finding their way. And that was really, in my view, the crisis group, if there was a group that was really challenged. The others had challenges and so on, but that was the one. And as reform came along, and I've been part of the Transformation Task Force and the Plenty Administration and every group there can be talking about this, my idea was to focus on the people who didn't have what they needed. And given the creep of everybody's improvement virus that they get, we wound up affecting more and more of the whole market. And to the point now that things are kind of turned on their head. And fortunately now, with the way the things are going in Washington, we can blame both sides. So there's an agreement about that. There's something to not like about it. The question really is, if I have an insurance card, do I have health care? And am I going to be healthy? And I think as I try to work my way around solving this, I will tell you that having a card with my name on it that gives me some chance to go somewhere is far different than being healthy. And we are in peril if we equate this with health. So I'll just leave it at that, and we're going to have a lot of discussions. And actually, we're good friends. And so we're not going to be throwing too many things, although I do have a weapon here. And she can reach it as well, so I don't know. Thank you.
Well, thank you for having us here. And I know that you wanted John Marty, so big shoes to fill, but John asked me personally if I would consider doing this, and then I received the call from here. So I worked closely with John since before I even was elected in 2006, and shortly after getting elected, we did go, a few of us with John, around the state for a tour, speaking about the Minnesota Health Plan from the north to the south and back to the metro. So we were working out there for it. We were hoping that maybe this, by now we would have been seeking a waiver from the ACA so that we could actually start one in the Minnesota Health Plan in Minnesota, but that's not the way the politics went. So in the meantime, I've been working on addressing HMO problems, getting audits for them, addressing the reserves that they have, working very hard on some of those things. And then more recently, a cost analysis study of the Minnesota Health Plan. If we're serious about it, let's know how much it actually costs. Let's know what it actually saves. So we're actually talking real facts here. Although there have been studies across the nation, and there is one that was done relative to Minnesota fairly recently, that every single one of them says that a program like the Minnesota Healthcare brings savings. So this is very important. More recently, then also we've been working with the keeping the plans that are coming in from DC or whatever to be not as bad as they could be, and trying to get the MNsure up and running, because one of the things, pause here for a minute, one of the things we did with MNsure is we tried to get the public programs in there as a part of the computer. You could go in and not only sign up for an insurance plan, but you could also sign up for a public program. Well, the public programs are on very old legacy software. Transferring that all of a sudden to another system was practically next to impossible. And that is actually the summary of why we had so much trouble with MNsure. We were trying to do too much in too short a time. To say that anybody could set a program to have you be able to sign into a healthcare plan, why don't we use the national one? Yeah, it's true, but we were trying to accomplish more than that. So we really, 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 really had a hard time. But if we changed to the Minnesota Health Plan, we wouldn't need it. And we would save $44 million a year just not having it. So there's little things like that that all add up to savings. I know that in DC, some of the things they're doing now, it's very interesting to watch them try to solve problems that they think that are there, and show up, in my book anyway, to say, see how stark this is? It's give the tax breaks to the wealthy or pay for 22 million people to have health care. Not a very good choice, but it's very, very starkly out there that that's actually what it is. So it's interesting. The more they try, the more they show how it's not necessarily the way to go. And I just have to say that I do enjoy Jim. Ever since I came into the House, he was the go-to guy to get a Republican on your bills. And he's much more accommodating than some of the folks, and he's a good guy. And in the Senate now, it's interesting to watch, because he's basically, we're 33 to 34, and he's basically 34. So this is an interesting challenge for the caucuses in the Senate, to keep that, to have it work when we're 34 to 33. It's a close cut of votes. But we can talk more about the individual market problem, which, as I understand it, the Obamacare, the ACA, actually couldn't solve it, so they left it for later. Well, later hit, and now the states are trying to solve it. The Minnesota legislature put hundreds of millions of dollars into it to temporarily solve it, and Jim can tell you more about whether that's actually happening right now or taking a little bit more time, and what do we do after 2 years. So this is some of the problems that have to do with the system that we have now, of which I would like to see otherwise.
I think we're getting closer to a solution then. And so this is such a large topic, and so we'll try to keep it interesting for you and productive, and then we'll take questions, and then hopefully everybody will get something, at least you'll increase your knowledge about how to solve this. My general view is solving healthcare in a political environment is crazy. We can't solve anything hard in a political environment. We have to solve it in a thoughtful environment, such as the individuals who are here and those watching at home. The North Metro in particular is full of people who are pragmatic and reasonable and can work with each other and without coming to blows. And that's what this is really going to take. And the more you get into the political side of people's heads, the worse it is. And so, but each side means well. But for example, on the side of the Affordable Care Act, Obamacare, the desire was to get people covered. And so most of the people that were added into coverage were put into Medicaid, medical assistance, heavily subsidized state program. And worthwhile goal, but it's very expensive. And in a time when there's a $20 trillion deficit, gives a lot of Republicans heartburn. And so the Republicans now, to fix this, think, well, if we gave people tax credits and gave insurance companies subsidies, then that would be the way to do it, which is actually very expensive in a $20 trillion deficit and gives a lot of Democrats heartburn. And they both cost almost the same amount of money. and so it seems to me that both sides have erred in not bringing at least a few members of the other side along with their ways of thinking. And when the ACA passed, I was very critical of the leadership there for not dragging a couple, at least progressive Republicans, along in some way to, you know, you'd have to move it to the center a little bit, but it could have been, it might have lasted. The things that pass with one party passing them all never stand, because the other party runs a campaign, oh, look at this. And then Mitch McConnell, you can't make this up, decided that he was going to write this, not even with his own people, but by himself with his staff. And he said in the paper, with no Democrats. Like, you know, no women. There you go. Yeah, good point. League of Women Voters. But so, how can this succeed? And if you want to, and Medicaid, the whole Medicaid system, which I'm the chairman of that, we spend $15 billion on our Medicaid system in the Health Human Services every 2 years to help people, people with disabilities, people with elderly, kids, mental health, and all that. And so, but it's a mess, and it's not lean and organized and orderly and effective and focused, and that does need a lot of reform. But to try to combine these two really hard things in one project without anybody helping is the definition of just, I'll call it lunacy. The product they came up with was not a good product. And so maybe each side has that out of their system now. And do you feel better? Okay. And so now maybe we can find a way where we can address people's health, not just so much getting them an insurance card. So, and the Minnesota plan, I suppose I should react to your comments, but I appreciate what the idea is there. When I was in 5th grade, we would debate communism in its perfect, pure communism where people take as they need and give as they can, right? It's wonderful. And not calling what you're saying having communism, but it's all aspirational. If only we could get doctors to work for less. If we'd only get a surgery from $73,000 to $20,000, wouldn't that be wonderful? It'd be so much cheaper. And Dave Dernberger, one of my good friends and mentors, has said over and over again, there's enough money in the system to solve all this. But I will tell you, try taking $1 away from the Mayo Clinic or the U from their health little programs and see how that goes. Right, Darby Nelson out there, you've been through a lot of this, and it's good to see you still active, and you were a good leader, still are. But anyway, so is there a way to actually seek truth and what's right to help everyone? I think so with people who are reasoned. I think that for our differences here, the two of us could put together a pretty good package that would actually stand the test of time. And the whole Minnesota Care thing that was done in 1992 or 93 is an example of that, where it was a bipartisan, and it was a group called the Gang of 6 or 7 that worked on it, and it stands to this day as a testament to something that people worked out. So that's my goal. That's my dream. I have a dream.
And I would just say that may that day come when we can work together, because actually when I was in my first year in the legislature, there was some working together on both sides. I experienced, and I thought, oh, this is different than DC, this is good. It only was 1 year later that when I went to a person who had signed on a simple little bill that I had and said, we just need to make one word change, she said, oh, I don't think we're supporting any Democratic bills this year. And that was the beginning of the change. They literally refused to participate in any way that had to do with the other party. And so little by little, the DC politics have come down to Minnesota, and that is very serious and very problematic. There's got to come to a point where we just say, all right, forget it. we gotta solve this problem, and it doesn't make any difference where you come from. But what will bring that? What will, you know, I hearken back to the marriage amendment. We were going to say that it had to only be between a man and a woman, and that didn't pass. So then people said, well, we can go all the way and actually make gay marriage legal. And some people said, ooh, you got to take this step by step by step. You can't jump in there. It'll be too fast, too much too fast. But instead, boom, that just with the help of people, with the help of the groups that were out there saying love is love, it just went through the people so that representatives and senators could vote for it without being slaughtered at home, or they actually said, I will vote for this because I can't not, and if I don't get reelected, that's okay. And it went. And nobody anticipated, except maybe John Marty, who said 5 years before, this will take about 5 years, and he hit the number, that it just sort of like, you sort of fight to get to the edge of the cliff, and then boom, you just go off. Maybe some sense about healthcare will happen that sort of way, where we'll just come to a point where we say, oh, for crying out loud, we've tried everything. Let's just make it work where we cover everybody, and we'll work this out as we go, because no matter what you do, you're going to have to work it out as you go. Nothing is perfect. So maybe the system will just collapse. But the players, not Mayo and University of Minnesota, they may object to some things, and we'll have conversations. It's the health insurance companies that we created. We created them and then lost control in that sense, they would basically be eliminated unless we used one of them as a third party to actually pay the bills. And so they will fight tooth and nail to not be eliminated unless they said, oh, we can get other jobs. Unless they said, we got to change this for the good of for our own families. Unless they said and waked up and said, this has to change. But the problem lies in how we do it. No other, as just probably been said many times, no other Western nation, no other industrialized nation has this problem in the same way that we have. And they have different ways of doing it, but they all cover everybody. So there's not just one way you can do that. You can do it different ways. I know that France covers 30 diseases universally, period. Germany uses different health insurance companies, but they're very severely regulated. They don't make the decisions, the people do. So there's different, and then Great Britain is the one that has the whole system under the government. Even the doctors are working for the nation. And Canada is a single-payer nation where there's actually, in your province, there's a single payer, but it's different provinces run their own show. But everybody's covered, and the doctors are operating as their own private, and the hospitals are operating as their own private providers. So there's many ways to do this. And certainly if we started to discuss it for real and had a cost analysis study of, for instance, the Minnesota Health Plan, and started to take it seriously, we would work through it and vary it according to what both sides want and come up with something that was for the people, not for profit. And that, to me, is the bottom line. It's not for profit. Anytime I think, I have a son-in-law that works in California in one of the big investment companies, and he says healthcare is, a couple of years ago, he said healthcare is the most profitable investment. And I said, why? Yes, if it's advances in technology and something, and you're helping new businesses get going, that would be something you invest in to help something new come. But if it's an investment because you're investing in the insurers and you're getting your investment money off the backs of people who are sick because they're not getting covered, this is a problem. This is a moral problem. Economically, it's actually proven to be cheaper. Let's work out the details. Morally, it's right. And then medically, it's very sound. You get covered. And I'll just say that we talk about health care, and we've changed it from medical care to health care because we want to emphasize people getting more healthy. But, when my 3-year-old grandson jumps off the picnic table and falls against the cement fireplace and gets a big gash in his forehead, he needs medical care right now. And it was just as that story goes, he his mom is home alone with 2 little boys, and she's covering up that wound and thinking, how do I drive? But I don't want to call an ambulance because I don't want to make it more bigger trauma. So she calls Uber. And get in the car, and it's not very far to the UCLA emergency ward where they went, but had to go that way. And so I call that medical care. There's times when you simply need medical care, and you need to be able to afford it, and you need it now, and you don't need to go bankrupt to get it. So we need to discuss this further and deeper around the moral, economic, and medical issues involved.
Something has happened in these 2 centuries of my service. I remark, whoever thought of that, that's really kind of funny. But when I first got elected back in the late 90s, if you would have done a vote on a constitutional amendment about health care as a right, it would have failed, in my opinion. People didn't think of it as a right. It would overwhelmingly pass now, I don't know what %, but it would pass very handily because people somehow will see this. But we're back to the point, is my right to have a card? Is my right to be healthy? Is my right to, do I expect that someone should look after me and pour health care into me to make me healthy despite my best efforts? But the phenomenon is that people, they look for a job with benefits now. It's gotten more expensive, it's a big deal, they want to have a chance to get some kind of health care or medical care or whatever. Probably chiropractic care would be a really good idea. And actually, more people are discovering what a benefit it can be. But both parties have noticed this, and that's what this flap in Washington about is in particular. The left has been much more embracing of healthcare as a right than the right has been. And so I think that's part of the gyrations that you see in Washington, because this is just my view of it, and so how do the Republicans, when they don't want to admit it's a right, like give it to everybody who wants it? And so, tax credits, subsidies, or just whatever. It's really kind of, it's a bit of a gyration, and I think at some point they have to admit what they're trying to do. I think that will be a breakthrough time, and I'm not sure if the answer will be the Minnesota plan, but I know someone who's a big fan of it up here. But at least we can then acknowledge what it is we're trying to accomplish. I took a tour to Germany a couple of years ago, and it was Admiral Bismarck, I think, if he was an admiral or whatever he was, but they credited him back in the last century for coming up with this universal health care idea for Germany. So they tried to find a way to make it sure everybody got something. And there's different tiers of what you can get, but everybody does seem to get something. And they're having trouble with that same idea on long-term care because their system, they do collect a tax, but it's way underfunded. And so, but I think that's a really key point to understand is that the evolution of American thought into this idea, that it's something everybody should have a piece of. And so then once you get to the point that everybody should have this opportunity to be well, not independent of zip code or what your gene pool is or what your parents did. Now you can begin to discuss what is it we're going to provide. Should it be free for everybody? Should everybody have to pay something? Should it be anything you want, or should it be a narrow set of benefits as France has? But we haven't ever gotten to that point because we're still stuck on this. We don't want to admit that we're after the same thing. And I'll tell you, politics is a horrible, horrible virus to add into a conversation. And it's funny to me, I don't know if it'd be funny to you, but the Republicans were gleeful that Obamacare failed. They were, in my little side of the aisle, they were just dancing in the streets. And if Mr. McConnell can conjure 50 votes for his project, the left is going to be dancing in the streets about that. That's not helpful. It's not helpful in a debate when you're right and you gloat and then try to take over power. And in a country where we're so closely divided, there's couples I know who do not agree. They vote different ways. But imagine living in that family. But in our country, we are just a few percentage points away of it tipping either way any old time. And I remember one time in 2002, we were in a caucus working on redistricting because we wanted to hold power. And some wag who turned out to be a governor not long after that said, hold power to do what? And I will challenge, I want to acknowledge Senator Newton is here as well. He goes to a lot of stuff, and we have a long history back and forth. And so if we would be asking the question, to do what? He and I could give you a list of things that we have done together in a collaborative way to do the what's. Help our students learn more and be well educated. He's gotten cardiac devices, AEDs, into schools. We've done a lot of things for transportation to help people move and live. And so my challenge to anybody who wants to weigh into this, work on the what. And I've always thought that good policy made good politics, compared to the trying to conjure up making someone stumble so you can take advantage of them in an election. So I still dream, and I think it could happen.
As you get some questions going, I'll just say that nothing is free, and instead of paying premiums and co-pays and deductibles and all these things, we would be paying according to our ability to pay premiums via the Department of Revenue, but it wouldn't be taxes because it wouldn't go to the taxes, it would go to the board that would supervise Minnesota Health Plan. So nothing is free, however, it wouldn't be unaffordable.
Let me just offer one more comment, then I'll. And so in this quest for health, I will also remind you, health is not what a pharmaceutical company can create in a chemical to treat whatever you have. And we are duped into thinking that what's the latest medicine to make me well? Carrots are a good idea. Water, people should drink more water than Coke. And also, what the insurance companies pay for may not be the best thing to be healthy about. So even if you get the card, at the end of the day, you're in charge of your health, you and your doctors. And I suggest you have a team of them, one of every different kind, so you can decide, I want to be healthy. They'll go like, really? Most people come in the office wanting to not be sick. Let me go over my thing, and then I want to go back and do all my bad habits. And just to encourage us that with a collaborative political world and you in charge of your own health care and people actually working toward that could actually work. Thanks.
Well, thank you, guys. I would just, this is maybe not appropriate, but your comment about power, being in power. And I think there's a difference between power and control. And power, as a school administrator, I defined as energy in order to accomplish something. And it seems as though our legislative bodies are stuck in an inability to do that because of the need for control. And those are different. And hopefully we can get to a different place. So there's my editorial. Sorry. Okay. I would, for those of you who are interested in the book that is being referred to, I have the address for that, and it is, and it's not a test. You can talk to me later, but it's Healing Healthcare: The Case for a Common Sense Universal Health System, and the URL is minnesotahealthplan.org. You can download this for free. So Carolyn has mentioned it a lot this evening, and if you haven't read it, you may be feeling a little bit like, what? But so that is something that you can look up and have access to. So here's a tough one for you. How do you envision federal legislation impacting our Minnesota health system, or lack thereof?
Hopefully they won't change something at the federal level. I think that they're having some difficulty doing that, and I hope that they don't, because it would impact Minnesota very negatively a lot. What they've had plans to do would have cut us down. I don't even know what the number is, but it's very devastating. So we don't want that. I hope that that's one of the reasons they're changing some of this stuff. I don't want, the reason that people changed from being politically anti-Obamacare is because they received it. And then they went, oh my goodness, I have health care, I have access. And now they wanted to take it away, and they said, no, wait a minute, I want it. And now Obamacare, ACA, is very popular. So that makes me think in terms of the drugs that you were talking about, because one of the things the Minnesota Health Plan does is say that if a pharmaceutical company advertises direct to the consumer on TV in an advertisement, we will not pay for that drug. So don't do it, because it raises costs and it misleads people. So things like this is something that you could do if you had a system that allowed you to have some say in the process. But as for the federal area, what do you think?
Well, I'm not very happy with the work they've done, and the contrast. There's different people affected in different ways. That's the challenge. You can't. There's not just one button and everybody's fine. You have people with disabilities who very much can need a lot of services, and we should serve them. You have some people that are frail elderly who need a lot of care, and you also have people who are farmers and independent business people who are spending $30,000 a year for premiums. They've lost their choice of doctor because of the health plan. We didn't spend enough time bashing health plans, but we can come back to that, because we universally agree that they are really have lost their soul. And so they've got these narrow networks, and the deductible is the price of their down payment of the house they bought. And so based upon that problem, then my colleagues, I guess they're on my side, have come up with some really poorly thought through plans. And as I mentioned before, to try to reform Medicaid, which is in dire need of reform, along with the whole healthcare thing, without a really vigorous process, has resulted in a product that just is not going to work. But a lot of the things that people say about that are based upon what we think will happen. The legislature still has many decisions to make before anything happens. And in terms of my leadership, whatever happens, and changes are inevitable in some way, my priority list are the people with disabilities, frail elderly, and kids. And the work I will do in my efforts as one person will be to protect those groups above all, because those are the ones who frankly have no capacity to adapt to what's going to happen to them. So I can't imagine they're going to pass that. And so the joke, I like jokes, and so they're getting so desperate. I was reading today, they might actually have to go bipartisan. Whoa. Things are going so bad that we may have to talk to the other side.
Oh my gosh.
I hope they do. That'll be a much better product.
So I just want to, there's another question here, but I think you answered it. So that Minnesota would not be able to fully pick up the slack that would be created by the current proposal, but there would be a prioritization of addressing those needs.
That's right.
Okay. So I just want to make sure that that question also was answered. So do you envision that Minnesota needs a CBO? Congressional Budget Office?
Oh. We have one. It's coming in 2019. We have now a legislative budget office.
Okay.
And so if you wanted one, the governor agreed that we could have one after he left. And it was a small part of a very large bill. And I think if I were voting just on it up and down, I would say no. But now we have two mathematicians, so we'll have to see how that works.
Well, I'll just make a comment on that we have the Department of Minnesota Management and Budget, MMB, which does the fiscal notes, which analyzes what we're doing and tells what the costs would be to the government or to the local government areas. And because it's a Democratic administration, the Republicans that are in charge in the House and Senate now didn't trust the MMB to do what they wanted, whatever. It's been a long-term problem. And so they wanted to do it someplace else where they would have more control about who was running the show. So they have created in the legislative LLC, legislative whatever, LLC, a budget office, which would do what management and budget does now. So it's repetitive, and now they got to be trained to do it. They got to pass that over there. They got to cut the money from MMB, give it to the budget office over here, which would just be the fiscal notes. So it's not really what, I think it's Oregon or some state actually has a budget office, which is more like the CBO and actually analyzes things, and it's a very well-funded, serious enterprise. I would go for something like that. But this switch from the MMB to a new one is just political to me, and not why. And the reason he said governor's agreed after he's out, because in the negotiation for this particular bill, the state government bill, which I sat on, we were able to get two things pushed off to a couple of years, hoping that maybe there'd be a change and we could then change it back. So it isn't until he got his goes, it's just that, yeah, we'll do this, but we'll do this in 2 years. So that's one of the things that were pushed off. So it's not really a CBO, but it's kind of a...
And I agree with everything you said, just except for one thing. Republicans weren't happy with the Plenty administration, with their administration's fiscal notes, or the Ventura administration. So they're just not happy with the... Anyway.
All right.
Stay tuned.
An abundance of unhappiness. Okay, you touched briefly, Jim, on long-term care, and that does seem to be a really huge issue that really does not receive a lot of discussion. So you had said that the elderly would be on your list, but how many, do you guys know how many of the elderly that are currently in nursing homes are on Medicaid, and what anticipation of massive cuts to that would result in changes for our Minnesota elderly and vulnerable?
Something like 50 or 60%, I think, in that range. Senator Newton is on the committee with me on the aging committee, and so he's actually put a lot of energy into some of that. But if you want to take him offline, he's really invested himself heavily in that topic. But I just want to remind people that these are proposals. And I don't like the one that's on the table right now, so I'm hoping there's going to be a hybrid of some sort. But even when they come forward, the states will be in the position to make some decisions about what we're going to do. And frankly, in my grand view, I think that we have overpromised to people what we can provide. And now where the money is coming due. $20 trillion is a lot, and especially when we don't want to be beholden to Russia and China and those countries who hold a lot of our debt. So you want to make promises you can keep. And so you're back to triage again, which is hard.
So here's a question about Canada, and I'm not sure if you're familiar. So what this person has heard is that doctors are leaving because their pay is so low. People wait long periods for surgery, et cetera, because there's not enough doctors. And if we were to have a single payer like Canada does in Minnesota or in the United States, what would we be able to do to prevent this cycle?
First of all, I don't believe that those are true. We hear stories now and then about such things, but the actual fact is that Canadians love their health system. I actually was visited up there in Winnipeg 2-3 years ago, and so we talked to both the majority and the minority in their provincial government, and they were working on correct. The minority was angry about some things in the healthcare, but I asked them straight out, but would you like to get rid of it? Would you like to change it? Or you don't want what you have? And they looked at me like I was crazy. They just want to fix the problems, which is constant. There's always problems and everything. They literally didn't have an answer. It was like, well, what? Well, of course not. When we hear stories of long waiting lines or long waits, that has to do with supply of providers. And that's a problem that they're working on, getting more providers for the specialist systems that are not urgent care, not right now, but elective surgery, for instance. They need more providers. They're working on that. There's always something to work on. But their care, their primary care, their urgent care, nobody waits. Here we wait. We wait several weeks to get into a specialist. We can wait months to get into a specialist. You could wait months to get into a new primary care provider if you were trying to change to a new system. That was the experience I had. And but once you're in, then you can usually do it in a reasonable period of time. But there's always, unless it's urgent, you can't get in right away unless it's urgent. But when it's urgent, you get in. But this is the facts, I believe, are not anywhere near what was described in that comment.
If you want to Google wait lists in Canada, you'll get a plethora of information about wait times. And I just did it just now. The average, there's wait lists in Canada. And
Or?
Everything. What do you want to know about? The average is 20 weeks. According to this, if you want to see a neurosurgeon, it's 46 weeks. A plastic surgeon, you only have to wait 25 weeks. If you have medical oncology, they get you in for only 4 weeks.
And then I would ask you the source.
Whatever, but there's all kinds of...
Whatever counts, but never mind.
Yeah, but there's a whole... At the end, there's a market in healthcare, and people would like to make money. And if you're going to pay less, you're going to have a harder time finding clinicians who want to go somewhere. And there's too much testimony about that topic to think that it's not true to some extent. And having sat through many single-payer discussions for 2 centuries now, when we talk about this, the pure single-payer supporters haven't found a system that they're fond of yet. Oh, what about the Austrian one? Oh no, that's not working. And so just with all respect, there's a kind of a hope for thing that it's going to be amazing. And maybe, I think we're going that direction, so I'm not telling you we're not going to get there someday. I think it's inexorable. And Governor Dayton said that this last business with the exchange and even the Affordable Care Act, he called it the last breath of insurance companies. And I think given, frankly, their greed and their inability to have a passion for mission and service, which people used to have in this country, businesses used to have a conscience and a soul, and now we've moved more into money. You look at United Health and some of the big ones, and they pay their CEOs over $100 million. That $100 million comes from hardware store owners who are not going on vacation so they can pay for their health insurance. And did anybody notice that? And so I think, given those challenges and the upset by the ACA and the phase 2 of whatever my folks come up with, I think we're going to see it in 10 or 20 years, I would imagine. I just don't know how it's going to last. This individual market challenge that just came up now where Blue Cross left the whole individual market. Blue Cross, who has been given their own chapter of law to work, that are as a product of Minnesota, of our legislature, in a bipartisan way, trying the HMO idea, the nonprofits. A nonprofit, in my opinion, carries a duty and a requirement about mission. And Blue Cross, as being the head of the pack, has become a bank and bent on profitability. And if that is the icon of what's running our insurance world, then we're in trouble. I want to caution you, however, for the single-payer fans, somebody has to run those things. In our Minnesota Care for All move, it's run by Blue Cross, Medica, Health Partners, and UCare, our nonprofits, who we struggle with keeping them on task. And so, and Medicare has some good things about it. The VA was once touted as one of the most amazing single-payer systems that you could look at. And run by the feds. You can go one-stop shop. It's all free if you're a veteran and qualify. And the press on that is it's a disaster for some individuals, as they've totally neglected the care. So whatever way we do this, these are all administrative discussions. Do you want to have this administrator or that administrator or another one? but it better be somebody who actually cares about the health of the individuals that they're serving. And so they want to cut sickness, not cut costs. And we have moved into cheap is better. Patients are capitations, and the doctors are widgets. And that's American healthcare. And that's why I'm encouraging you to work with, we need a system where you can work with your doctor for your own benefit, where you take an interest in yourself, where you keep track of your own health indicators, where you look at your genetics and go like, I better be careful, I better not eat so much of this because it killed my grandma. And so you can be in charge of it. That to me is the heart of the answer. And as we look over those who are more challenged and help them to achieve the best possible outcomes they can get.
Amazing. As I hear him talk, it's like he's talking about Minnesota Health Plan, and then he bashes the Minnesota Health Plan, but then he talks about it a little bit more. So, and I do want to go back to when you said the health plans are, we would mutually agree, are a problem. Look at the name. When did we start calling them health plans? And it actually confuses us because people have a policy and they think that's their plan, and I get it from Health Partner. Wait a minute, Health Partners is the health plan. So when did they take on and convince us that they should be called health plans? So Medicare, Medica, Health Partners, Blue Cross Blue Shield, they're health plans. Isn't that innocuous? Isn't that gentle? They're insurance companies, and they're quasi-public. We created them as an idea, and we're going to check it in 3 years. We did a study. The study was shelved. It never got produced publicly because it wasn't saving. But we went on with them anyway, and now we've got this heavy, heavy insurance companies embedded in us. At least they're somewhat a public policy. At least they're somewhat nonprofit, but they're quasi-nonprofit. So in the veterans, yes, it was a wonderful program. What happened? They cut the money that was given to it. Anytime you defund something, you cause it to fail, and then you say, oh, look at that, it's failing. This is happening way too often when you cut the funds to it and then say, oh, geez, bad. And this is what happened to the VA, a wonderful program. Trying to get some things back there. My goodness, we honor veterans and then we don't cover them when they're disabled or sick. Very serious lack of principle. This is why the Minnesota Health Plan is based on principle. There's principles, there's, I don't know, a dozen principles which would be the founding basis of everything that was done. It would be written in the law, this is what you must follow. The principles of everybody covered, and it's a doctor-patient who are going to make the decision, not the government, not the health insurance company, but the doctor-patients together is going to make the decisions. These are part of the principles on which it's based, and it would be written into law. So when you have something with a base like that, and you fund it properly, you can actually continue the work of taking care of the glitches as they come up, as they always will. But you had to get the profit out. You just got to get the profit out. This is interesting because I'm starting to say that our economy in the United States has many things in which it eats the people. In fact, it has become, what do we call, we don't call children, let's see, I'm trying to think. We use economic language on our children, on how we talk about the children. Do you have, I'm actually flipping out on what names these are now, but it's just, we are actually calling people around us economic terms instead of human beings. Even to say from a personnel department to a human resources department, a little bit more distance, but still got human in it, to a, what do we call them these days? Human capital. It's the human capital department. You know, you have financial capital, you have technological capital, you have shovels and what, and then you have the human capital. It's just one of the many cogs in the thing. It's just a thing. So then you say to a young child, does this child have relationship capital? Does this child have this capital? No. Do they have people that support them and take care of them? So we can't buy into this because the economy, our approach to the economy doesn't own us, and we are not under it. We choose how we're going to do the economy. We choose our system. We choose what it's going to do. We choose that. And instead, you know, the free market, you got to do it because the free market says, no, we have the belief that something should operate under a free market. We choose that. It doesn't own us. We own it. we got to turn this around, and healthcare will follow.
One topic that has not been mentioned tonight, oh, go ahead, applause. It hasn't been mentioned tonight, that happens to be a passion of mine, and that's mental health. And that wasn't listed in your priorities, Jim. About 20% of our population has mental health issues. Left untreated, those issues become progressively worse. Right now, Minnesota has the school-linked mental health services that have afforded an early intervention and really pretty easy access for families to get help. And of course, those would be gone with the Medicaid proposed cuts at the federal level. And I worry that they would be gone even if there is some kind of compromise. How would you address mental health, both of you?
Again, it's a matter of priorities, and actually in my head, when I think about kids, I think in particular some of the mental health issues. I just didn't elaborate. It's a real challenge. You know, Jerry and I are involved trying to help some of our veterans who are homeless, who are a laboratory for a mental health discussion, and they fall through the cracks, and we're working to remodel, get some Anoka Treatment Center cottages, and maybe we'll talk about that with you some more, with a private group, with our collaboration about trying to reach that way. And this is a private way to go and help some of these folks that have fallen through the cracks of a very expensive VA system that says they have all the mental health support, and they don't. And the hard thing about mental health issues is you can't really see it, you know, and so people don't understand it so well. And part of why I'm concerned about what they're doing is just because it's so haphazard. And if you're going to try to reform Medicaid, you have to do it tenderly, with an eye toward what you're going to undo that people count on. If you're going to make some big changes, people need a long landing path so that other entities can come to the fore. Very frankly, no one knows what's going to happen with the mental health side on any of the proposals, what choices will be made. And I mean, just Jerry and I, again, were represented in Anoka District, which had a spate of suicides not that long ago. And part of what I did was to help create a mid-level licensure, the licensed professional clinical counselors, and Anoka has taken advantage of that in a way to reach out to every school has at least one of them there. And so there's lots of ways to do this, and good people finding good collaborative methods can solve a lot of this. But I do want to help people also remember that simply throwing some numbers of millions of dollars at a problem, so here's money, go do it, doesn't mean that any benefit to speak of will come of that. And sometimes you can get much more benefit from a well-designed program with, you know, collateral support that has a lower price but much more effectiveness. And so if we can take simply what we have now in our money and make it work better, nothing much will happen bad at all. So that's my commitment, and the work I've been trying to do is to try to get the most you can out of what we have and help all those that are in front of us.
We had passed with Wellstone parity so that you would be able to fund mental health care at the same level that you fund, or at least with the same approach and willingness to take it on, not just you get 2 visits and then you're done, mental care as well as medical care. And that hasn't really come down the pike all the way yet. It's still working its way through.
I will share a story with you. When my son was diagnosed with an anxiety disorder when he was young, I had a mental health group tell me that he could have 4 sessions. And my response is, this is not Name That Tune. And it was like, that was a crazy response. And I think that a lot of parents don't have the capacity to advocate. So it needs some shepherding in it. And I'd encourage you to really look for that.
Right. And NAMI does a very good job of working things out at the legislature, a wonderful job, actually. And then when my predecessor, Barb Goodwin, pushed for making it so that we didn't put these people in jail. If there was an episode, they didn't just end up in jail automatically, but we could have a place where they could be brought and then triaged through there. And it did not pass at the Senate that time, although one pilot program is going on up in Bemidji. So sometimes we start with pilot programs. However, I have noticed a change, a big change in the legislature in the talk about this. It is always being talked about that, yes, we have to make sure that we're dealing with it so that they don't just end up in jail. It is changing in the minds and hearts. Hopefully from that will come something to actually make it happen. But this is an example, in my opinion, where, yeah, you need more money. You need more money to make some of this stuff work.
And just to kind of follow up a bit, we could discuss, you might want to have a whole meeting on this sometime. I was just going to suggest that, I was talking to Sheriff Stewart a month and a half ago, and he was talking that half his clientele, whatever, has some kind of mental health issue. They cover themselves in feces. That's not exactly what a non-mental health person would be doing. And so he finds himself very challenged in the penal system, where they just, and he's working to devise a system in the county where people get bifurcated into the punishment side if that's what they have coming, or if they have a mental health issue. You might invite him to one of your meetings. He's really kind of taken by it. And just also, mental health is not, it's not a single person. It's a broad range from autism to all the other conditions. And that's the challenge of it too. So you cover something, and you cover mental health for a certain amount of money, you capitate, and then that's the budget available, and then you run out of money in the insurance side. But you have an autistic person or a schizophrenic person, I mean, they both fall in that umbrella. And now that's the challenge. None of this is easy, which is why I'm going to remind you of my opening point. You can't do it in a political environment where someone is trying to score points to make sure that Abeler doesn't care about this, or Abeler does care about this, and try to win an election. You have to that's the danger of all this.
Where can we solve these problems? Because one of my questions is where do you think that healthcare issues should be resolved? At the federal level, at the state level, someplace else? How do we deal with this?
There are things that, for instance, if we were to address the Minnesota Health Plan, we would need the federal's cooperation. We would need waivers from certain things, and we would need the money that they're taking in for something, and we're going to do it, give us that money. We would need this cooperation. Can't do it without a major system. If we were to do it just on our own, we would have to reduce what our goals would be in order to start something. We are interconnected, big time interconnected, and we need to be able to work this out together. So the climate, or the tone across the country needs to come around. We have work to do.
And I agree with that, given the state of current affairs, but I think the feds are not helpful in our healthcare stuff. Minnesota ought to be the leader, and in many ways we are, or at least have been in the past. And we get about 60-some cents on the dollar back from them, and some other states get $2. And we have to get waivers to do anything, and it takes a year or more to get a waiver. By the time you get the waiver, you forgot why you wanted it. And the group says, oh, let's do this, great, okay. Come back in a year, we'll do the next step. What? And that's how plodding this all takes. And in my opinion, the Fed should just leave us alone. They should leave healthcare alone, let the states be laboratories. And the curious thing is, the people don't get smarter when they get to Washington. They're not just smarter there. And so if Minnesota succeeds in mental health or in autism or in some condition that we just really figured out, then Mississippi could adopt that. Like, oh, that's a great idea. Maybe Mississippi figures something out. But we don't do that. We have this, and that's one of the failures, I think, of the ACA, where and I'll give good intentions, but it's also the failure of my colleagues' counter response. They didn't realize this isn't our job. Let's let Minnesota run Minnesota, and let's let the states cherry pick the best ideas. And because what they forget, in the worst state of this country, and there is one on any particular topic, those people really cared about their people. They didn't try to get to be last. And so they would like to do better. And so let's help them do that.
I would just say that we can be glad to have him in the Senate also, even though we're in different parties. And Truman was the first person who tried to have a single-payer thing in the United States of America when we are the United States of America. And Eisenhower was the third one, actually, to try it, and it's been tried many times at the national level. But I think it's politically difficult, and to me that says way more about the high costs of our federal elections than it says about anything else. If we should have a shortened election period and less costs, then we might be able to talk about other things besides my next election. So, and in this,
Fewer commercials.
in this particular state, it's not, we are, I fought hard this time to keep things from changing the election structure in Minnesota because I consider it one of the refreshing states as far as elections go in here. And we need to keep some of those things, like, for instance, the public subsidy, which allows you to run even though you're not rich and you don't want to buy into special interests, and the PCR that allows individuals to be able to contribute and have a piece of the action in that sense of participating. It's wonderful, and we can't change those things because otherwise we too would be obligated to special interests in order to get elected, and then what? You know, it's just, we've got to stop that, not make it worse, not bring it to Minnesota.
Are there any other questions? Thank you so much, Jim and Carolyn. We really appreciate your time here tonight and your insights into these intangible and challenging knots. So thank you for your time.
Thank you.
I think we solved it.
If anybody wants this information, it's written up here so you can come and copy it down.
I'll just say, you just go to the Minnesota Health Plan, just Google the Minnesota Health Plan, and you can download this, or you can order it for $20. If you go to Amazon, it'll be $30. This is John Marty's book, yep. And that's another thing. We in Minnesota have it written out. So it's a good start. Other states are just talking about it, we've written it out.
We've got a book.
We got a book.
So if you have
I'll take this.
postcards, if you want to take a moment to write out a postcard and then leave them with us, we will manage that Google postage so that you can have your concerns expressed or your questions.